Hello, everyone, and welcome to this audio podcast. This audio podcast, and where this audio podcast, as part of the Pathology edition, as part of the Typhoon Twixter, as part of a Storm Robotics production, and as part of the Type 4 squad. This audio podcast is a synopsis in around this series, where this audio podcast series will delve into and look into an overview in around peer reviewed works, works from 2020, and looking at healthcare scientists or scientists in primary care, healthcare scientists or scientists in primary care, and where this peer review works was a systematic was a systematic review in around works from 2020, and this this audio podcast series looks to provide sort of have a basis in around an introduction, aims and the literature, the methodology, in around the methodology, findings and the themes, critical analysis and practice, and also some conclusions, and recommendations. And part of this audio podcast series, or part of this audio podcast synopses, as part of this the audio podcast this audio podcast synopses, an overview in context of an abstract, is as thus. In the UK, in the UK or the United Kingdom, is seeing there has been a continuing and important shift in the burden or impact of disease from in around disease, and in line to mortality, and morbidity, and in around morbidity. Much of the health impact or burden is preventable, and much of the in much of the monitoring around particular diseases or chronic illnesses, for example, occur in mild and moderate occur in mild and moderate, sort of in mild and moderate basis, in mild and moderate basis, in context of primary care, in context of primary care, with only the final stages of disease actually sort of monitored in around secondary care, secondary care, and and uh, at the same time, there in turn, this also means that access to education relating to diseases in the National Health Service, or NHS, face sort of varying challenges. So in around the aims of this works, carrying a systematic review over an 18-year duration. This work sought to describe the educational, what the educational sort of pathway in context of the chronic disease model could look like with laboratory specialists, and sort of scientists, healthcare scientists or scientists involved to prompt education. To prompt education surrounding in around particular diseases, chronic sort of in around particular disease, and aligned to the chronic disease model, chronic disease basis. And this work, the systematic review, sought to understand if CKD patients in around particular diseases, and for example chronic kidney disease, could attain more formed formed sort of more informed education in around laboratory tests and investigations, in around laboratory tests and investigations, since disease unlike chronic kidney disease are at a basis are and stem from a laboratory from a laboratory underpinning. And this laboratory this sorry this work this work or this audio podcast, a part of this audio podcast and a part of this peer-reviewed works, we'll delve into and identify if there is if there is a basis for scientists or healthcare scientists to be involved in primary care in primary care, and in around the design around this works, the systematic reviews from peer review works. Systematic review was carried out over an 18-year duration, and a critical appraisal skills program was used to identify peer reviewed works, and to identify peer review works, and wherein particular specific a specific grouping of terminologies against three categories were utilized, from 1,481 81 papers identified originally through several databases. 1,493 records were removed, and 30 papers 30 papers were further scrutinized after taking out duplicates for integrity and relevance according to terminologies, and seven papers were further excluded, and 23 full text articles were further scrutinized and two were further excluded, and 18 sort of 18 papers or peer review works were included, and five themes were identified and in around sort of the conclusions around this. There is a requirement to review the current there is a requirement to review sort of current sort of healthcare scientists or laboratory specialist workforce in and within the United Kingdom, and consideration for these healthcare professionals being available for those who are suffering with particular diseases, chronic diseases, in context of primary care. Now, in around some main terminologies to identify peer review works similar to this peer review works from 2020. Um, within databases online, terminologies can be used. For example, chronic kidney disease, healthcare scientists, and 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 also looking at sort of a collaboration, um, and looking at sort of skill mix, and as some of the sort of main terminologies that can be utilized in databases online to identify similar works. In on social media, there will be some citations that listeners can refer to identify further literature as well. And so and so and so this draws this synopses to a close in around this audio podcast around the pathology edition. This audio podcast is part of a Ty4Phoon Twixzter, and an audio podcast in part of a as part of the Type 4 squad, and an audio podcast as part of a Storm Robotics production. Thank you for tuning in.